everyone, so let's move towards our today's topic, which is radius is present in the forearm and it is present on the lateral side of forearm. There are two bones which are present in the forearm, radius and ulna. Ulna is present on the medial side and radius is present on the lateral side. It is a typical long bone. It is the only bone which will form the wrist joint. Okay, this bone form wrist joint with the carpal bone of scaphoid and lunate. Okay, the carpal bones are many carpal bones. So out of them, the two carpal bones are called scaphoid and lunate, which articulate with the radius bone and form wrist joint. There are three parts, as we have already talked about in the humerus bone, that in radius there are three parts: upper end, lower end, shaft. There are three surfaces: anterior surface, posterior surface, and lateral surface. There are three borders: anterior border, posterior border, and medial border. What is upper end? First we will talk about upper end. Upper end is like dhakkan shape, okay, bottle cap shape. It is disc shape, okay. It is covered by hyaline cartilage. It articulates with the capitulum of the humerus, and the circumference is fit into the radial notch of the ulna bone. Okay, in ulna there is a notch. There is a pocket like socket like structure in which the circumference of the head of the radius is will be fit in that radial notch of the ulna bone. There are annular ligaments which are also present, which are attached to the ulna bone, but they are present like a radius bone. उस annular notch is like canal like, okay, tunnel like होती है और उसमें radius bone मौजूद होती है. अब रेडियस बोन उसके अंदर रोटेट भी कर सकती है, मूव भी कर सकती है, लेकिन उससे डिसलोकेट नहीं हो सकती. One more thing, tuberosity is also present, which has rough posterior surface and anterior smooth surface, which is present below the neck. Below head, it is the surface is called neck, and below neck on the medial side, yani on the ulna side, there is a tuberosity which is present, radial tuberosity, okay, which fits into the ulna bone, okay, which we will talk about later in the ulna bone, but radial tuberosity is present. What is lower end? We will talk about now. What is lower end? Lower end is the end which is present on the wrist. आप कभी डॉक्टर के पास जाते हैं, डॉक्टर से कि यार रेडियल आर्टरी पल्स चेक करते हैं, पल्स रेट चेक करते हैं, तो वो रेडियल आर्टरी से करते हैं और वो रेडियल आर्टरी आपके रिस्ट में मौजूद आपके वहाँ पे नज़र आती है, फील भी आप उसको इजीली कर सकते हैं. जो लोअर एंड है वहाँ पे जो मेडियल साइड है, ओके, वहाँ पर on medial side of lower end, ulnar notch is present in which head of ulna is present. Okay, now laterally styloid process is present. Styloid process is like it is present on the radius as well as on ulna. It is like beak like structure or noke like structure, corner like structure, point like structure, which is present on the lateral side, and therefore it is called a lateral styloid process. Posteriorly, there are four grooves which are for extensor tendons, and inferiorly on the lower end, a triangular shape is present, and which will connect with the, as I said, के scaphoid और lunate bone के साथ connected होती है to form the wrist joint. Now we will talk about shaft. There are three borders and three surfaces: anterior border, lateral border, and anterior border, medial border, and posterior border. Remember, medial border is also called interostitious border, and it is formed by radial. It is formed from radial tuberosity to the ulnar notch. Anterior border is formed from the radial tuberosity to the styloid process, and posterior border is formed from behind the anterior border, and it consists of tubercle of Lister. So this is the identification to see के यार posterior border कहाँ है. Now we will talk about the attachments. Okay, what are the attachments? Let me first describe. So basically attachments are first I give you example, not example, it is basically the actual thing. So head is, what is head? Head is disc-like shape, okay. So its superior part articulates with the capitulum, ऑफ द ह्यूमरस, यानी जो ऊपर की सरफेस होती है वहाँ पर ह्यूमरस कैपिट्यूलम कनेक्टेड होता है ह्यूमरस का, और जो सरकमफेरेस है वो रेडियल नॉच से कनेक्टेड होता है, एज आई ऑलरेडी टोल्ड यू अबाउट दिस. नाउ supinator muscle on the lateral surface. Remember, on the lateral surface there are three muscles which are connected. On the upper end, or on the upper surface, on the lateral surface of the upper surface of the lateral surface, supinator muscle will insert. In the lower surface of the lateral surface, pronator teres is inserted, and the brachioradialis muscle is inserted in the middle surface of the lateral surface. One more thing, flexor digitorum originate from the anterior border. Radial tuberosity anterior part, which is smooth, is covered by bursa. Bursa is the fluid-filled cavity which helps to prevent the friction. And the posterior part is rough, which is present for the insertion of the biceps. Okay, it is originate from the humerus and it is inserted in the ulna of the radial tuberosity of the ulna. Flexor digitorum muscle is originate from the anterior border, okay, and flexor pollex muscle originate from the upper anterior surface. There are anterior surface and lateral surface. Lateral surface consists of three muscles which are inserted, and anterior surface is divided into two parts, upper part and lower part. Upper part is for origin of flexor pollex, and the lower part is insertion of pronator quadratus. Posterior surface is for the origin of two muscle, abductor pollex longus muscle and extensor pollex extensor muscle. There are 6 grooves which are present in the radius and ulna. In the combination of radius and ulna, there are 6 grooves. First groove is between anterior border and styloid process. Second groove is between styloid process and dorsal tubercle. Third groove is between dorsal tubercle and medial tubercle. Okay, and fourth groove is between on the medial side. Fifth groove is between radius and ulna, junction of between radius and ulna for the path of extensor digiti minimi, and sixth groove on ulna. Ossification, we will talk about ossification. So the shaft ossify from primary center in the 8th week of the human fetus development, and lower end ossify from secondary center. Remember, upper end is shaft is ossified from primary center, and lower end is ossified from secondary center in the first week of human development. So guys, take care of yourself and study hard, work hard, and good luck. Bye.